The Aeos has made more accessible the surgery for all the surgical team. I work at the CMN, the National Medical Center at Mexico City. We perform about 6 to 10 surgeries per day, and we perform all types of neurosurgical procedures. Sometimes with a microscope, you cannot share what you are doing in real time with your team. In this case, your team is aware of everything in real time during all the surgery. My personal preference is to set up the Aeos behind me and the robotic arm from one or other side, and the monitor in front of me at the foot of the patients. I have found that this is a better way to keep everything controlled, and the smaller monitor is always for the surgical assistants. The positioning, the robotic-assisted arm has improved substantially my practice, because now I don't have to use two binoculars close to my eyes, and my head doesn't have to follow each movement. Precisely, the lock on target allows the surgeon to multiply the range of motions in the exoscope. You don't have to move your head with the microscope, and you have no anatomical limitations. We train 6 neurosurgeons per year. It's easier for an experienced surgeon to take the system of Aeos to improve his techniques, his surgical techniques and skills. And it's also easier for the residents when they are exposed to the system, because they learn from the very beginning of their training how to use this digital visualization, because it is very intuitive. The very first generation of Aeos residents graduated, and I am sure that the future is now.